Let's focus on health. If you have allergy-related symptoms, you're certainly not alone.
Yeah, we're hearing doctors' offices are swamped right now with people looking for relief. So what can you do? Well, let's go to the doctor's office here. Dr. Timothy Quinn is here to talk about all of that. Dr. Quinn, good Monday afternoon, sir.
Hey, good afternoon to you.
Now, all types of allergies are out there right now. Are you seeing any that are more prominent than any other time at the moment?
Well, I mean, we have right now our typical spring allergies. The most common things that people are allergic to, especially here in Mississippi because we have so much greenage, would be your pollen, your trees, your grass. Because right now, you know, everything is starting to grow. Our yard man, he's come and he's turned our sprinklers on. It's time to start cutting those yards. I hear those lawnmowers every Saturday. It's a great time. It's festive, but at the same time, a lot of people are suffering from those particles in the air, those antigens, and they're getting that runny nose, that cough, that sore throat, and it's making a lot of people miserable.
Dr. Quinn, if you can't get in to see a doctor, are there any homeopathic remedies you'd recommend?
Most definitely. What we recommend for our patients, because we're getting just flooded with phone calls every day. You know, I'm having sore throat, runny nose, sneezing, all the typical symptoms of someone that is having allergic rhinitis, which is having allergies to the pollen and whatnot. We'll advise them if they're not having any fever, if they're not having a productive cough, or symptoms that suggest that they have infection with some type of bacteria or even coronavirus or the flu, we ask them to try the over-the-counter remedies, such as your loratadine, which is your Claritin, your Zyrtec, your Allegra. Those antihistamines are very effective. And then they could do the nasal steroid, such as your Flonase. That's over-the-counter as well. This is a good start. And in a lot of cases, patients will get relief and not have to go to the doctor. So this is something that everyone should consider.
Dr. Quinn, is this allergy season shaping up to be better or worse than most seasons, or about typical? How do we stand?
Well, it's actually, I can't really say better or worse. It might be a little bit worse than last year. And I'm going to tell you a very interesting finding. I was looking at some reports, and last year people were wearing masks more for the last couple of years, but we're starting to take our mask off because we're getting lower prevalence of coronavirus in our community. The mask actually added protection not only to help us avoid coronavirus and the flu and other respiratory tract infections, but it actually helped us to avoid those symptoms of the allergies because you were breathing in less of those particles into your respiratory system. But the bottom line is, if you do have severe symptoms of allergies and you tried the over-the-counter remedies and or you have fever or productive cough or body aches, it's probably a good idea to go ahead and check with your medical provider to make sure that you don't have the flu, which we've seen this year, or some type of bacterial or viral infection such as the flu and or coronavirus.
All right, thank you. Thank you, Dr. Quinn. Appreciate that.